And now to some breaking news. We've been following a measles outbreak that has infected nearly 100 people in West Texas, could now possibly be here in Central Texas. Today, health officials reported people in San Marcos could have been exposed to a person who tested positive. Since late January, 90 cases of measles have been identified across 7 counties. Most of those cases are in Gaines County. That's where the infected person who was visiting Central Texas is from. Hays County's health officials say a person who tested positive for measles was in San Marcos early this morning on February 14th. That's a Friday. Now, that person was visiting from Gaines County, as we told you, where there are now 57 confirmed measles cases. Health officials say anyone that was on the Texas State University campus that afternoon or who ate at the Twin Peaks restaurant that evening could have been exposed. The maps on your screen show the potential locations and paths where the infected person was on campus. The Hays County Health Department says they are working closely with the Texas Department of Health Services and other local health agencies to contact trace. We talked to a Texas State student who says she's concerned.
I'm more worried about others who are more at risk. Myself, I'm not very at risk, so I don't worry for myself personally, but I do worry for others. I'm definitely going to be watching out for symptoms just so I can know to avoid places that have a lot of people come, or avoid people that I know are at risk or anything, especially visiting my family. Sadly, I might have to put off if I do feel like I have symptoms.
Hays County health officials say they are working to contact people who may have been exposed. And we'll have more later on KVUE News tonight at 10 o'clock. Now, this marks the largest measles outbreak in Texas in more than 30 years. The Department of Health Services says the majority of cases are in people who are not vaccinated or whose vaccination status is unknown. The disease is highly contagious and can spread through the air. It can also stay on surfaces for 2 hours, even after the person has left an area. Common symptoms include high fever, cough, runny nose, and red and watery eyes. After symptoms first appear, you might see tiny white spots inside your mouth, and the measles rash that usually starts at the face and then spreads to the rest of the body. If you think you may have been exposed, contact your local health officials for further instructions. Monitor your conditions for the next 3 weeks, and if you have any symptoms, please do not leave your home and call a healthcare provider immediately. They're asking you to not go to a healthcare facility so that you don't expose other people to this disease. Now, health officials say the best way to prevent getting measles is to get the MMR vaccine. They say 90% of people who are not vaccinated or have not had a previous measles infection will become infected